makes the face look less long this way. If your teeth show, if you want more of that, it can also look really pretty. The chin shadow area, right in this area where it looks a bit shadowed, in the jawline, those two paired with a lip lift are so beautiful together. Then adding the corner area can make everything look softer. Hi everyone, Prem Tripathi, board certified facial plastic surgeon here. I'm in the Bay Area, and if you like this type of content, like, subscribe, follow for more. I'm on all the major platforms, and so here we go. Okay, so a popular procedure right now for making the lower third of your face more beautiful or youthful is a subnasal lip lift. That's shortening the distance between your nose and lip to get a more pouty, more youthful mouth. But there are some modifications that can actually be done to make the mouth or the lip area really look youthful, rejuvenated, and fit the rest of your face. Because if you're laser focused on one area, you may be missing the forest for the trees, or whatever that expression is. So let's go into how to get the most beautiful lower third by surgical and non-surgical treatments. The first one I want to talk about is the obvious one. It's the lip lift and all the variations of that lip lift. That's a procedure that's done in the office. It takes about 30 to 45 minutes. Markings are the first part, and then we take skin out from underneath the nose, shorten that distance, and you get some turnout of the red lip portion of your mouth. Now, it's really nice for the right person, somebody that already has really pretty lips. It can look nice. If your teeth show, if you want more of that, it can also look really pretty. But if your lip is on the thinner side, if the corners of your mouth are already downturned, it can actually make things look much worse. And then there are some adjunct procedures that need to be done to adjust for that and make it really look its best. So one procedure I'm doing more of now in patients with that sort of anatomy is a corner lip lift. That is where we actually make an incision right on the body, right at the vermilion border above the body of the lip, to bring out the corner of the lip. And the modifications there can also be done to take it down into the lower portion of the lip here to bring the corner of the mouth up. This is not to give you a Joker smile. It's not to make you look pinned or stretched. It's really to make you look more rejuvenated, because if you're lifting the lip up this way and it brings the corners down, then adding the corner area can make everything look softer. This can also be bolstered with fat around the mouth as well. But a corner lip lift can also be done in the office, and in the right patient is paired with that subnasal lip lift. That will give you a softer area of the lower third of the face. It makes the face look less long this way, and the lips look softer. What I really like about these types of treatments is you can pair them with other things. Fat around the chin shadow area, right in this area where it looks a bit shadowed, in the jawline. Those two paired with a lip lift are so beautiful together, because through time what happens is that the bone of the face tends to shrink and shrivel up, as does the skin in that area. It tends to lose collagen, become darker because the fat is going away. So when you add something bright like fat, it can soften that area, it can highlight in those areas that are shadowed, and it can make the lips even look softer. You don't even have to put filler in the lips to make that area look softer. But when you combine these treatments, they really can take your results truly to the next level. The last and important piece of this is if your lips are starting to get longer here, odds are you have wrinkles around the mouth. And you can have these smoker lines even if you don't smoke, because you've destroyed collagen through time, didn't wear your sunscreen, or maybe you did, you're just genetically predisposed. Or as the bone tends to shrink and shrivel up, that skin starts to look different and change and age. And as that happens, that skin in that area tends to develop these lipstick lines, these vertical lines that just are deep in there and very hard to remove. So once you've done things like fat injections and lip lift procedures, laser resurfacing now is sort of that icing on the cake. It smooths out those deep lines, it softens that area. You can do your full face, but that lower third of the face is what really truly harmonizes with the upper part of the face. The main goal in facial aesthetics primarily is softening areas that are starting to change and highlighting the eye area. And once that's achieved, when the lower part of the face tends to shrink and shrivel up and look retracted, we want to just balance that out with the rest of the face. We don't want to overdo it and give you a witch's chin, or build out your jawline and give you a more masculine face. These are all little small touches to soften a face and make things in the appropriate patient look more feminine, look more masculine, and look softer. It's all about softening. Now, it's not to say that we want results to look minimal. We want them to look natural, but still dramatic. so that when you look at it before and after, you can see a sizable difference. But every day out in public, you're not going to notice anything huge, and neither is anybody else. You're just going to look like the best version of you. So the fat transfer portion of it, we take fat from your belly or thighs. I process it to smooth it out, and I actually add some growth factors to the fat. That's my little trick for anyone that wants to use it. Adding the growth factors can help lengthen the longevity of the fat and give it some nutrients to help it last a little bit longer. And that is used and smoothed out to almost like a filler consistency. It can be used to soften the lines around the mouth. It can be used to soften shadows, marionette lines, nasolabial folds, even temples and cheeks, under eye area. So it depends on where you use it, but in the mouth area, most people think it's just going to make things look bulky. It really can soften those deep lines, especially when you pair it with those laser treatments. So if you're interested in these types of procedures, facial aesthetics, and cosmetic surgery, like, follow, and subscribe. I'll see you next time.